So, good morning, good afternoon, and good evening to everyone, wherever you're joining us from whichever part of the world, and wishing everyone a very happy Human Rights Day. It's truly inspiring to see so many individuals united here, transcending time zones and distances to discuss something that binds us all, our fundamental rights, and the collective future we envision. Whether it's the start of your day, the middle of a busy afternoon, or late in the evening, and as I hear some of you are in the midnight right now, your presence, I think, is a testament to the shared commitment to the cause that brings us together today. I'm deeply honored to address this esteemed gathering at the Global Summit organized by Youth for Human Rights India under the theme Our Rights Are Future Right Now. I shall like to extend my special thanks to a very dear friend of mine, Dr. Anjum Zaidi, for giving me this opportunity to speak here today. So today I join you to together reflect on one of the most essential aspects of human existence, and that is health. Health is not merely a biological condition, it is a human right, deeply interwoven with our dignity, autonomy, and progress. The theme of my discussion today is the right to own your health. It's not just a concept to be explored, but it is a resounding call to action and a vision to be achieved. So, what does your owning your health mean exactly? Owning one's health is about far more being free from illness. It's about autonomy, dignity, and the power to shape one's destiny. It signifies control over decisions that affect your body, your mind, and your overall well being. It means having access to quality healthcare services, preventive measures, and the tools to make informed choices. But owning your health also extends beyond personal actions. It requires an environment that supports health, clean air, safe drinking water, nutritious food, and adequate housing. Thus, true health ownership is about empowerment, the freedom to make choices without systemic or societal barriers holding you back. Now, why is this right so critical? Let's reflect a little bit on that as well. Now, health is a foundation of a meaningful and fulfilling life. Without it, I'm sure you will all agree, our potential is limited, our aspirations are deferred or delayed, and our freedom is curtailed. Owning, owning your health is not just a personal right, it is a societal necessity as well. Healthy individuals create resilient families, strong communities, and ultimately a prosperous nation. But let's face the reality as well. Do we truly own our health? The sobering truth is that billions of people across the globe do not. The right to health remains a distant reality for many. Poverty, systematic inequalities, a lack of accessible healthcare infrastructure, I think these all act as a formidable barriers that rob millions of the people of their ability to own their health. Hence, consider a mother who cannot access prenatal care, the worker unable to afford treatment for a preventive illness, or a young person whose mental health needs are stigmatized, dismissed. I think these are not just stories of individual struggles, they are reflections of a systemic failure. Each lost life, each untreated illness is a profound failure of humanity. Hence, even when healthcare services exist, deep inequalities still persist. Cultural stigmas, gender biases, and systemic discrimination, they prevent countless individuals from seeking care. The elderly are ignored, the women face disparities in treatment, and marginalized communities are trapped in cycle of neglect and inequality. I think that brings us to ask, who truly owns their health when poverty restricts access to nutritious food? When corporate lobbying shapes healthcare policies? When environmental degradation caused by few affects so many? As intellectuals, we must recognize that the right to own health is not only an individual issue, but it's also a collective responsibility. It is shaped by the policies we advocate for, the industries we regulate, and the cultural norms we challenge. So we must ensure and we must work towards it. I feel that one, first of all, I feel that the governments they prioritize universal health. Equitable policies are the cornerstone of health ownership. The second, of course, would be corporations that should act responsibly, putting people before the profits that they intend to make. Then societies, they foster an environment that promote health equity and address disparities. Now, while structural reforms are essential, the other side of the coin is definitely personal accountability. Yes, we ourselves are very much responsible for our health. Owning your health begins with awareness, understanding the impact of nutrition, physical activity, and of course, mental well being. Now, owning one's health begins with personal choices. So, what can we do? First of all, we need to educate yourself. That is, knowledge is your most powerful tool. Understand your body, your rights, and the resources available to you. Health literacy empowers us to make informed decisions. And so, seeking this knowledge is so much more important for us. Second, of course, is to prioritize the well being. Every choice matters: what you eat, how you move, how you manage your stress. Now, these are seemingly very small decisions, but they have a very profound impact on your health. The third, of course, would be to advocate for a change, protect systems, but there need to be some solutions to this, the problems that we are speaking about. So, support initiatives that bring healthcare to marginalized communities, advocate for policies that make universal health coverage a reality. And also, I think we need to demand accountability from industries that profit from public health. And thus, the summit's theme, Our Rights, Our Future Right Now, is a powerful reminder that time for change is not tomorrow, but today. The right to one's own health is not a privilege for select few people. It's a universal right that must be realized today. So, owning your health, I would say, is not a passive entitlement. It's an active pursuit, a shared commitment, and a moral imperative. It is about reclaiming the control of your own life and ensuring that every individual, regardless of their circumstances, has the opportunity to live with dignity, with knowledge, and without compromise. I think that is something so much very essential and core to the entire problem. Now, as we reflect on this Human Rights Day, now let us remember that health is the foundation upon which all the other rights that we are going to speak here they rest upon. So a healthier world is not a distant reality, it is an urgent necessity, and it begins with each of us for sure. Take it forward from there. Now, when we empower someone to own their health, we give them freedom to dream, to contribute, and to live fully. This is not just an individual victory. In fact, it is the very foundation of a thriving, just, and equitable society that we are talking here about. Together, we have the power to create a world where this is right, is not just recognized or realized by everyone, but everywhere as well. So I think in the end, I would just say let us pledge together to work collectively, decisively, and with compassion towards a world where health is not a privilege, but a universal right. Together, we can create a future where everyone's own health is important and also a part of the future that we are looking towards. Thank you.